were like, oh, what? I'm going to have an impact on the health of Australians? And I think particularly some young people came up to me who worked in finance and said, I don't think I'd have any impact on the health of Australians, but now I understand where you're coming from. So it's really good for people's values and for their purpose in work to know that their opportunity and their privilege at working at a big organisation will have and can have a positive impact on some of the decisions they make.
I'm Dr. Louise Massara, and this is the Future Health Podcast. We all know the benefits of a healthy diet, but we aren't always that good at following the well-evidenced advice of our public health colleagues. So are there new channels, partnerships and tools we could use to have a greater impact when the key decisions are being made, whether that's online or at the checkout? Are there evolving opportunities for the health and commercial sectors to come together and advocate for a healthy Australia into the future? To navigate this conversation, we're calling on two expert guides. Public health physician Dr. Jan Feazell, who works in the Division of Population and Public Health at the New South Wales Ministry of Health, and Simone Austin, an accredited practicing dietitian and author of the book Eat Like an Athlete, who is also the Chief Health Officer at Healthy Life and Chair of its Health Advisory Board. Welcome, Jan and Simone. Jan, can we sort of start with the basics, and maybe could you give us a sort of useful way to think about what we mean when we say the commercial determinants of health?
Sure. So a lot of us are familiar with the idea of social determinants of health. So, our education, our access to transport, housing, all things impact our health. And the commercial determinants of health are how private companies can also impact our health through how they go about their business, their employment conditions, all sorts of other areas that also impact our health. And so it's something that people are becoming increasingly mindful of.
I mean, you're right to talk about that as a group. I suppose when I think about it as well, I mean, GPs are corporate actors in a way. They're running a business, and we're all probably as individuals corporate actors too. But I suppose for the conversation today, we're going to sort of think about the scale and influence of the big corporate actors.
Correct.
Okay.
Yes.
Okay. It's quite interesting to see some of the big corporations, multinationals, non-health entities sort of starting to dip a toe in the healthcare space. What are some of the benefits and maybe some of the concerns that are raised when we see these sort of novel actors in the health environment?
I think one of the really great opportunities is they've got enormous reach. They're in our homes every day, they're everywhere, they're our places where we work. So they have enormous reach for health promoting behaviours, but also the concerns can be that not all health promoting behaviours turn a profit. And so it's about that balance between doing good and doing great things versus, things that we've seen perhaps historically, like how we feed our babies, use of cigarettes, all these sorts of things corporations have promoted, not necessarily for the good of health, and even after evidence that what they were doing was perhaps detrimental. So I think it's important that we think about both health promoting and health limiting behaviours.
Simone, you work for Healthy Life, which is sort of sits within the ecosystem of the Woolworths Group. You're a clinician. Can you tell us how that all sort of fits together to give the audience some context?
Yeah, so Healthy Life's been around for about 4 years, and I've been there since the start. And we're a separate business of the Woolworths Group, so we're a pretty small business, around 60 versus, a couple 100,000 sort of. And I feel like my role is like a public health role within a commercial business, which is pretty unique. I'm a dietitian by background, and I chair the Health Advisory Board, and I'm the Chief Health Officer. So my role really is about being a resource back into Healthy Life to set the tone of how we should be thinking about health, some sort of guardrails about even when we talk about health, and then also back into other businesses of the Woolworths Group when they might want some guidance on what are the biggest health topics for Australians, or what should we be thinking about, or talking about what you were before, that corporate lens, where can we influence for the benefit of the health of Australians. So it's a fantastic role because it's all about health for me, not about the dollars.
And Simone, obviously we have a lot of listeners that are health professionals working throughout New South Wales Health and beyond. It's always interesting when we hear about different career paths and options that people have taken. You're a dietitian and we've credited a book in the introduction. Can you tell us a little bit about your journey to Healthy Life?
Yes, I was quite happily being the Advocacy and Policy Manager at Dietitians Australia at the time, which was even then a bit of a different role, and this Healthy Life started, and I have always had this part for public health. I worked in elite sport alongside working in other corporate entities and running a private practice at the same time, but I think I always came back to thinking, I want a message on a big level and I want to make an impact. And I could always see that we could talk about the impact as much as we like, but unless we actually got the commercial people to make some changes, then really we were just always going to come to a bit of a loggerhead of actual change happening. So I thought this was the perfect opportunity for get my message on the inside. So that's probably why I wanted to take this role. And I was a bit intrigued as to, it's sort of a public health role, but in a commercial business. So I was a bit intrigued at how I could make a change.
In that role, you release a report every year. How do you go about deciding how you're going to theme your report and what goes into that?
That was really makes me laugh because when I'd only been there about 6 weeks and someone said, could you write a health report for Woolworths Group? And I'm like, would you like to give me some parameters? That's a really big task. And we're up to number 4, and this year we chose harnessing the digital world for better health. And that was sort of a flow on from last year's, which was around protecting the health of our future generations. And so I think that harnessing the digital world is great because those younger generations actually don't know what life is like before the digital world. They're sort of digital natives versus people like me who are digital immigrants. So we thought that was a good next step. And then we look at data, and Woolworths Group now has more visits to their web and app and digital assets than it does in-store visits. So people are even just researching online before maybe going into store. So we thought, okay, well, from a health point of view, we need to really harness that. If people are online, how do we use that for the benefit of health? So that's sort of how we came with the topic for this year. And the health report's very much an advocacy tool for health. Internal, because we've got a lot of people and a lot of players making
180,000, a bit like us, I think, in New South Wales Health, about the same staff number.
Yeah, and so that's across all your supermarkets, all ages, everywhere in Australia. And then it's also an external tool because we do have some resources to be able to produce a report. We've got a lot of data that we can use, and therefore we feel that that's useful to other people. And so that's part of our role to, I suppose, give back and make sure that we can promote health and see what we can do.
Do you get any pushback that there's a sort of a commercial entity creating a health report?
Yeah, I think when we were talking earlier, I was saying to you, it's to see number 1 report versus the interest in number 4. I thought we would get a lot of pushback, and I was watching every word I wrote and how I'd write it, and someone's going to ask me a question on this. And surprisingly, no, because the report was written very much just from a factual, evidence-based point of view. So there really wasn't anything we could pick. It was not about selling product. It was about this is what's happening in the health of Australia. But from number 1 to number 4, we've just seen that growth of people using the data without thinking that there's something behind it, that there's some other reason for writing the report. So we've built up that trust, and then we've found that it's been very useful data for people to use for advocacy.
Jan, that all being true, we still do have sort of 2 sectors here who are ruled by different masters. You know, we have the commercial sector, which has responsibilities to shareholders and the like, and we've got the public health sector responsible to the citizenry. And so, you know, there will be issues that come up when we look at opportunities to bring these 2 sectors together and see those lines blurred. What are some of the things we need to keep front of mind while we try to remain open to the fact that new partnerships are going to be critical?
I think the key thing is understanding where the different actors are coming from and why they're wanting to do a particular thing at a particular point in time. And where we can seize the opportunity to work collectively together, that is absolutely fantastic because, you know, often things are on the same trajectory for both groups. But then when there are differences, understanding clear what those differences are. I mean, we often know that, for example, pharmaceutical companies, we know that they often sponsor patient support groups. Now, that's great for patients to get support, but then they also can use those same groups to lobby for medicines that are perhaps not cost effective to be used either within that patient group or to be put on, government spending. And so I think it's really important that we understand why somebody is doing something. And, then what we do see, though, is a lot of codes of conduct becoming, more and more visible, so that those interactions between commercial sectors and the community are much more regulated, or at least there are standards that we could expect people to be held to.
This isn't a sort of a new blurring of the lines. We've had the relationships between corporate entities and health for many years. Could you give us some examples of where it's worked positively?
So many. I think one of the interesting things that we have is in New South Wales, we have at least, some of our breast screen clinics are sitting within David Jones or Myer, for example. And one of the ideas of that is it's a place that you go just to have something routine happening. And so rather than having, to go to a special location, to be in a place that you may not be as comfortable, by having things accessible to people in places that they're comfortable, it's really exciting, for them. And, well, maybe not exciting as far as breast screening goes, but at least it's something that, can be much more accessible as far as parking and access. It's not necessarily a strange location, so you don't have that issue around where am I going and how am I doing it. And also it's a visual reminder to women as they, I know at Parramatta it's in their lingerie section, for example. So as they're shopping and thinking about their breasts, perhaps, as you do when you're shopping for lingerie, as many people would do if they were shopping for lingerie, I think, it's a natural thing to be able to see, breast screen's there. And maybe you've seen an ad on television, maybe you've seen an ad on YouTube, and it all comes together for you there.
I mean, that's the big opportunity, isn't it? It's like, we talk about prevention and a need to pivot as a health system to prevention, which means we've sort of got to look at the steps before as to where we can make that impact. And, when we think about healthy food choices, it's one thing, Jan, for you to be giving us evidence-based messages on TikTok. But it's another thing because you're not in people's front of mind, perhaps when you're at the supermarket making a decision at the checkout. So it does feel like we have to see health find ways that maintain the trust and credibility of health, but sit at the place where people are making their choices. How does Healthy Life get involved in that space?
So I suppose Healthy Life employ a few dietitians, for example, and we develop some tools. So one of the tools is Food Tracker, which when you do your shopping and you scan your rewards card, it compares your shop to the Australian Dietary Guidelines. So that's a fantastic tool that people can then, when they're shopping, go, okay, need to load up a bit more on the fruit and veg next time, and you can set goals. So some good digital tools like that. Free fruit for kids as soon as you walk into the supermarket, sponsoring of kids' sport and then providing fruit and veggies, healthier recipes online. But, it's how do we get those to be bumped up to the top? So there's a lot of tools there that can be used. Healthy Life then write lots of articles on the report. Each year now for the last 4 years, we've shown how are Australians eating for at-home eating. And it's more than just the Woolworths supermarket data. It's all data for at-home eating, just not your takeaways, cafes. So people can see on average what are Australians eating. And you can have a look yourself, but it also allows people within, say, the group developing new own brand products or anything to say, we really need Australians to eat more legumes, or we need them to eat more grains. That's gone down a bit. So that's also in their mind when they are developing new products. Or I'll go and talk to all the different teams about the report, because they're making decisions about what will go on the shelf or what we will put on special or all those sorts of things. So I think there's a lot of ways we can get the people making decisions to have be equipped with some more information. And people were like, I'm going to have an impact on the health of Australians. And I think particularly some young people came up to me who worked in finance and said, I don't think I'd have any impact on the health of Australians, but now I understand where you're coming from. So it's really good for people's values and for their purpose in work to know that their opportunity and their privilege at working at a big organisation will have and can have a positive impact on some of the decisions they make.
I mean, that leads us really into that conversation about environments.
Yes.
Can you explain to the listeners what you mean when you talk about environments of impact?
I love talking about supportive environments for health, but in this role in Healthy Life and even back into that Woolworths group, people didn't really know what I was talking about. I think often health professionals talk to health professionals and we forget to explain outwards. So I'm talking like Jan was saying, it's all those things around you in that physical environment that influence. Is it healthy eating? Where is the shop? Is it close enough to walk to? What does it sell? Do I have a kitchen even that I can cook in? Do I have enough refrigeration space? All those things. But then there's the digital space that now fits into our physical space. And you could be in the same physical environment like we are, but people can be a very different digital space at the same time in the same physical space. Because you could be looking up a healthy recipe and Jan could be looking up which restaurant she's going to, and I might be watching a non-health person give me health advice. So I could be getting really bad advice, you might be getting great. I think we have to learn about how those digital environments now influence what we then go and do in our physical environments. And that's quite exciting because for health promotion, you can target quite well your digital environments.
Jan, how is public health and health promotion already playing in the digital space? How sophisticated are we now in how we target our messaging?
So if we look much more broadly, when we've got particular messages for particular communities, you won't see them if you don't speak Vietnamese, for example, or you won't see them if you don't speak Arabic, because we know that there are particular messages that speak to a particular community. And so we're much better at making sure that, say, if you're watching Vietnamese videos on YouTube, you will be much more likely to see a health ad in Vietnamese. You know, we can geo-target where things are going. We can cut by age groups and, looking at other channels such as, what are the websites that parents go to, so that we can, work with those groups to sort of put out content that provides those messages. Are we looking at older adults, knowing how they, may or may not engage digitally, and how do we actually get messages to them? How do we help them engage with things? Because that's one of the things that we can see, older adults getting left behind. We saw this, for example, with the COVID vaccination, when we were all going online to, get our vaccines. If you didn't have your digital life happening, it was much harder for you to book an appointment. So how do we make sure that we don't accidentally exclude older people, particularly from those digital environments? Because some of them are much more literate than I am. No competition. But there are a lot of people who get left behind. And the other groups that, of course, can get left behind are people who have less access to internet, to their phones, and who've got limited data and so on. And we also know that can also happen to much more vulnerable communities, and so you can have a lot more trouble getting messages through to those vulnerable communities if you're looking only at digital.
When we think about the opportunities for a sort of a brief public health intervention, we've often in our minds gone to the GP, the community nurse, a health professional being the vehicle for that. Are there ways we can collaborate with our corporate partners, cousins, who are sort of custodians of our patients, perhaps more often than we are in health? And is that happening? Are we looking at ways in which we can sort of spread the message outside of those digital spaces where people are making their choices?
I think what you do see is we're getting much better at being really clear around guidelines and so on about what we'd like to see and when things are changing. What do we expect for physical activity for a different age group? And also helping people understand where perhaps we want to emphasise. So, for example, young adults and adolescents, there's a critical period of time between primary school and becoming a working adult where people drop out of sport and physical activity. And so if you have a workplace that actually encourages things like lunchtime activity or out of work, social netball and all of those sorts of things, it becomes less of a competition between work, and it's actually becoming something that you can do as part of work. And so there's definitely all of those things. But there's also that ability to clearly sort of talk about, we're really worried about, sugar sweetened drinks. That's a huge conversation all the time. And so it's by, sort of saying we're worried about these things that we can actually promote, changes in how corporate entities behave.
So Simone, look, acknowledging there will sometimes be different agendas. There must be opportunities where it's a win-win for both systems. Can you give us some examples of where you've had some win-wins?
Yeah. Some of the things that we have seen work well is the Outdoor Media Association and AusVeg and Health and Wellbeing Queensland, for instance, had a big promotion on nutrition and it's affordable eating earlier this year. And so they used the data from our 2024 report on how much did it cost to buy a serve of vegetables? How many more do we need Australians to eat? So we're quite happy. What data do you need? Tell us what data you need, and we may be able to help find it, and then therefore they'll promote it. But we also wanted to know, well, what's your message and how would you like to promote it? Share resources, and we can use our channels. Because as you said, we've got big channels and big reach. I think that what's your message? What would you like to get across and what works with us? And let's work together on that, because often they can be similar messages. We're happy to get them out.
Jan, is there a space at the moment where we are bringing corporate entities into the discussion around these channels, use for these channels?
Look, I think what you see a lot of this work happens at the grassroots level between a local health district or a particular group, the health promoting group in a local health district, and local actors. And I think you also see at the Australian government level a lot of this sort of work. So it's happening at all the different levels, the engagement. And also I think New South Wales puts out a lot of data as well that can also help inform what people choose to do.
I think some nervousness is understandable when you're bringing two groups with those different agendas and those different masters together. Do we have to change the way we all work together into the future to broaden our impact? Is that just the reality?
Look, I think to ignore what's going on in private sector is to just miss all the opportunities you can have to positively influence. And I think that's something that we're always very, very aware of. I think one of the key things that we can be concerned about, as you say, is where, it's sometimes easy for a quick profit to be made. We see it with people who spread misinformation. We can see it on big social media channels and how things have changed when social media channels, for example, have gone from, no, you can't spread misinformation to, well, actually it's open season again. And that has huge influences on the population. And, to be quite frank, as a state government in little old Australia, there's only so much we can do about the big wide world. But at the same time, if we don't keep engaging, if we don't keep trying, then we're really leaving a major hole in, what can be a really positive opportunity as well.
I mean, that raises for me that question of the importance of the trust in New South Wales Health as a brand and the necessity for very careful placement on the basis that we do live in this swirl of disinformation, misinformation, manipulation of information. So I'm sort of not suggesting we throw out the baby with the bathwater, but I mean, that must be a big challenge that you're facing as a public health unit, how to select the environments where you can put these messages where they remain safe messages and they're not influenced.
And I think with the speed of change as well, where you can be partnered with a really reputable organisation today, but things can change. You can have a corporate takeover, you can have a change in ownership, you can have a change in direction. And so a group that you've partnered with, was solidly and had a really good relationship with, changes direction. You can't pull away that branding or the co-branding overnight. And so that can be a real issue if you've co-branded in good faith around a particular program and then you find that the programs change because of corporate needs. How do you actually pull yourself back and maintain that trust and that reputation, as opposed to New South Wales Health promoted this thing. This thing is now not a good thing. New South Wales Health, you're bad.
There obviously has been some improvement or change in regulation over time. I think back to, when we had tobacco brands sponsoring sporting events and the like. It's that balance, isn't it, of creating a regulatory framework that supports where we can work together but does safeguard the public from some of those risks.
And I think, for example, the whole development of e-cigarettes and the whole conversation around e-cigarettes is one of those areas where, for example, we had enormous interest by tobacco companies very, very early. The issue around whether they were helping people quit smoking or whether we were actually promoting young people smoking through a bridge environment, and how quickly it became obvious that, it was actually going to be a huge problem for young people. And I think that's one of the key things is really understanding where people are coming from, what their motivations might be, and working out how can we actually protect people if we are actually seeing a risk on the horizon, even when something looks like it's going to be a public good, potentially. And let's face it, for, a number of people who are having trouble discontinuing smoking, they are actually getting a public good from this. But the vast harm that was being done by accessibility was astonishing.
From a dietetics perspective, I'm interested in the progression of information. We've just, we understand what we know today. So, it's completely different to what we knew 10, 20 years ago. There's this sort of ecosystem of everyone trying to do the right thing, but a bit confused about what the right thing is. It almost seems like every day, a glass of red wine's good, it's bad. Dark chocolate's good, it's bad. How can we play in this space better? Yeah. How can we get a cleaner... Can you just give me a sheet of paper that tells me what to do?
The hard thing is that food is just never black and white, and because we're all different. And I think for some dietitians it can be quite fatiguing too. I know some of my colleagues say that they're exhausted from trying to dispel misinformation, because it is. And one article wants to say caffeine's good for you, and the next one is saying, no, it's not. So it is about making sure that you do have the latest evidence, obviously, and the expert opinion, but also not making it too hard. And I suppose for myself, I always think the Australian dietary guidelines that everyone says are a bit boring, and look, they are under review, but really go back to some of those, and we don't need to make it as complicated as we are. The things that are changing, you say, some things change and some things don't, they haven't really changed all that much. It's just that people wanting often to sell things change them to make it, because it still should be eating lots of fresh fruit and vegetables, which your grandmother probably told you, and we should be eating mostly whole grains, and we should be having less discretionary, and we only need bits of meat. It's not really a lot different. There's some parts we've learned a lot more, like, say, gut health, and we've learned how that will affect basically all parts of our health. Now, that's really exciting because people don't want the boring message anymore. They don't want to be told just eat fruit and veg. So if we can jazz up that same message in look after your gut bacteria and look after your gut health, which is still evidence-based and true, but it's telling the story in a different way. I think it's not about always the misinformation. How can we give people the right information, but in a way that they feel it's still a little bit exciting and new? Because if it's just the same message, people don't want to hear it. So that's part of the challenge, to keep it evidence-based, but still a little bit exciting. So just a bit more kale, quinoa, chia seeds or whatever. What is the next thing,
what is the next thing?
Yeah. I wish I knew. Maybe it could be a conflict of interest thing. I'm not sure, but it doesn't have to be that complicated.
So, Jan, the exciting thing about the futures is it's sort of not here yet. And so we do still get the chance to make choices and decisions today and influence our friends, family and community. And I know there's been some work done and studies that show that really small changes can make a profound difference in the not too distant future. Can you talk to us about that?
Look, what we know at the moment is we have a tsunami of diabetes coming our way. We have a tsunami of other chronic diseases as we age, and we can't do a lot about the fact that we get older. Most of us would celebrate the fact that we have had the opportunity to get older. However, what we do want to do is live those years in good health. And what we've seen recently is the causes of ill health. Previously, it was things like trauma, severe infections and so on that would cut our lives short. Now what we're seeing is people are living longer, but what they do live with are chronic diseases. And so one of the things we can do is help change that future. And that's what's really exciting. And that's things like helping people do, a brisk 20-minute walk every day. It doesn't have to be all at once, but if you have a brisk 20 minutes of walking each day, you can lower your risk of diabetes by something like 30%. So that could be the walk, to the train station. It could be the walk. It doesn't have to be...
So you get off the bus one step earlier or one step earlier.
Exactly,
and walk
all
the
of
rest.
those things. It doesn't have to be, a huge lifestyle adjustment. It's those small things. And again, how we eat and what we drink, particularly, because if we can move people from sugar-sweetened drinks, sugar-sweetened recovery drinks to water, for example, it can have an enormous impact on, the calories in type part of the whole horrific equation, and it can make a big change to what happens to people over their life. And I think that's the key thing. It's about keeping that evidence base, because we keep understanding different things about diet, we keep understanding different things about exercise, but it's those small changes. It doesn't have to be a big change, those small changes that can help keep us well, and particularly for young people, keep them on a healthy trajectory through their lifespan so that they're not already set themselves up for a problem.
Simone, Jan, there's no doubt the future will bring more collaboration, and we can only all benefit from creating ways in which we can get those win-wins. Thanks very much for joining us on the Future Health podcast today.
Thank you.
The views and opinions expressed in this episode are those of myself and today's guest, and do not necessarily reflect the position of New South Wales Health. Any content provided is for informational purposes only and should not be interpreted as endorsement or approval by the organisation. New South Wales Health does not endorse any products, services or companies mentioned in this content.